Hi, welcome back. Dr. Adam Rosen here, talking to you today about another topic, one that I think is very important, one that you have access to every single day, and that's over-the-counter medications. If you're not aware, I did publish a book that came out last year, the Knee Book, a great book and a great resource for anybody that has knee pain. It talks about why your knee hurts. It talks about how you can treat your knee and how we can treat your knee, and what a knee replacement is and how to get a good outcome. This topic today is so important. I cover this in chapter 5, so over-the-counter medications. And why is this important? It's because these medicines can be dangerous. They can be harmful. They can be helpful, but they can also be harmful. And when you see your doctor about a prescription for high blood pressure or for diabetes, they talk to you about the risks and side effects. But many of these over-the-counter medications people buy without really understanding the risks. So that's why I want to cover this topic. One of the more common medications that people will go to or pick up if they have pain is acetaminophen. Acetaminophen is the generic of Tylenol. So these are the same drug. These come in 3 different strengths commonly. You have 325 milligrams, which is regular strength. You have 500 milligrams, which is our extra strength. You have 650 milligrams, which is arthritis strength. And you need to know what you have, because when someone says take 1 pill or 2 pills this many hours apart, if you're using the regular strength, you're getting a smaller amount. If you're taking that dosage, but with the arthritis strength, you're getting way too much of that drug. Now, the common recommendation around the world is 4,000 milligrams a day, so less than 4 grams of that total per day. In the US, the FDA has lowered that to 3,000. Why? Because one of the leading causes of liver failure was Tylenol overdose. And what was happening was when people were taking high amounts of painkillers, things like Vicodin, Norco, Percocet, they also contain Tylenol. So if you had pain and were taking over-the-counter Tylenol based on the bottle, but were also taking a prescription pain pill with Tylenol, you were exceeding the amount that your liver can tolerate a day. Also, a number of cold and flu remedies over-the-counter contain Tylenol. So you were taking that plus this to reduce your fever, and you were taking way too much Tylenol than what your liver can handle. So they've lowered that dose to give you a little bit of a buffer. Now, do you have liver disease? If so, you probably shouldn't be using Tylenol because it typically gets cleared by your liver, and you want to be aware of how much you're taking and for how long. So you need to talk to your doctor and make sure that that is a safe drug to use. Now, the other mistake that I see are people that are on blood thinners. And they will come in and say, I was on a blood thinner, I'm taking an anti-inflammatory because my doc said I can't take Tylenol. And usually they got that backwards. So I don't know what their doctor told them, but if you're on a blood thinner and there's a risk of bleeding, Tylenol is the safe drug. So if you're on things like Coumadin, which is warfarin, Eliquis, Plavix, Pradaxa, Xarelto, any of those medicines that on purpose thin your blood for some other reason, Tylenol does not thin your blood and cause bleeding, so Tylenol would be the safe drug to go to. If you're on those blood thinners, you do not want to take anti-inflammatories. So anti-inflammatories are otherwise called NSAIDs, non-steroidal anti-inflammatory drugs. There's a whole bunch. So you have ibuprofen, which is also Advil. I could not find a bottle of Motrin, so I'm sorry. Motrin might send me a sample, but Advil, ibuprofen, Motrin. Same drug, generic and brand name. These are 200 milligram tablets. You also have naproxsyn or Aleve. Again, same drug. These come in 220 milligram tablets. And this is where it gets confusing because I hear people come in and they'll say, I was taking Tylenol, but I was taking the 200 milligram tablets. Probably not. They were either taking ibuprofen or they messed up what the dose of the acetaminophen was. And just to confuse things even more, you can get a cream anti-inflammatory called Voltaren or diclofenac, which you can find over the counter. So those are all the same, what we call class of drugs. So what I tell people is you do not want to take Aleve and you do not want to take Advil together and tell people that you took an anti-inflammatory. That would be like going out to dinner and ordering a Coke and a Pepsi and telling people you had one soda. Now, you can get a soda and a glass of water, which would be taking something like Advil and Tylenol. This way you're taking a medicine that's an anti-inflammatory and a painkiller. And this is something that is sometimes recommended when you have pain that one drug won't help, what we call multimodal, because the anti-inflammatory works on inflammation and swelling. It's cleared typically by your kidneys, where the acetaminophen works more on pain and is typically cleared by your liver. So there's not that risk of a double drug risk interaction, because if you take two anti-inflammatories, you're doubling the risk on your stomach, which can cause ulcerations. You're doubling the risk of bleeding. You're doubling the risk of kidney disease. So you have to be cautious with those drugs. Now, typically, if you have pain, you can take the Tylenol, depending on the dosing, 2-3 times a day. You can take the Advil or ibuprofen 2-3 times a day. You can take the naproxsyn, sometimes twice a day. When you're using the cream, it'll even recommend up to 4 times a day. So again, read the instructions on the packaging to make sure that you're not exceeding the amount based on the drug that you're taking and the dosage that you're taking. And if you're thinking about combining two, make sure you speak to your healthcare professional to see whether or not that's a safe thing for you and should you lower the doses of both. So again, a lot of information that I think is really important, and it can be confusing, but definitely talk to your doctors, because if you're going to take a painkiller like acetaminophen, there are different strengths and different doses. This is cleared by your liver. If you have heart disease and if you're on a blood thinner, this would be the safer drug of choice to take over the counter. If you have inflammation, pain, swelling, and you're not on a blood thinner, and you do not have kidney disease, and you do not have a history of ulcers, then you might take things like an anti-inflammatory, like Aleve or Advil, Motrin, and Aleve. But again, that can increase those risks. Hopefully this keeps you out of trouble. Your pharmacist is a good resource. So if you're going to the pharmacy, take these up and you might be able to go over your risks. If you use the pharmacy, they can look at your medications and give you a safe option on what to take. So don't harm yourself. Use these if needed, but always check with your healthcare provider to make sure the drug and the dose of the drug that you're taking is safe for you. Thanks again for listening. I'm Adam Rosen. Until next time, stay safe.